This is the final presentation for CSC 490 Directed Studies course, and we will be discussing several factors that contribute towards chronic illnesses. Today, we will discuss the main motivation behind this research and why chronic diseases are such a significant problem. We will also discuss how they're currently being resolved in the current healthcare system, and we will discuss how this research contributes to the situation and if this approach is successful. Finally, we will discuss some of the limitations in this research. The main motivation behind this project. The driving force behind this course is the global crisis of chronic illnesses focusing on diabetes, lung cancer, and chronic kidney disease. These conditions contribute significantly to global mortality. The urgency arises from nations lagging on targets to reduce premature deaths from these diseases. COVID-19 pandemic further had many challenges which disrupted the health services to help patients understand and be aware of these chronic diseases. The significance of this problem. The chronic disease problem is very important as it has a global impact, and it is claiming almost 41 million lives annually. Death rates from these diseases like diabetes, lung cancer, colon cancer, and liver cancer are worsening in many countries. The sheer scale of this problem demands immediate attention and comprehensive strategies to prevent, manage, and raise awareness about chronic diseases. The current strategies. Right now, the main focus is on stopping chronic diseases by making lifestyle changes. Health programs want people to eat well, exercise regularly, and avoid smoking and drinking too much alcohol. But the tricky part is that many people don't know how likely they are to get a chronic disease based on their health and lifestyle conditions. There are programs such as the Diabetes Prevention Project that have done some good job in the community by making people more aware of making better and healthier choices. Our approach in this research project. This project stands out by utilizing Power BI dashboards to visually represent and analyze extensive data sets related to diabetes, chronic disease, and lung cancer. We have innovatively integrated business intelligence tools for comprehensive data visualization, offering insights into patient-specific details such as age and other contributing variables. Uncovering influential factors through visualization empowers individuals and policymakers to make informed decisions. The unique contribution lies in inspiring collective action through the compelling data representations that underscore the gravity of chronic diseases. We can look at the diabetes dashboard in more detail. Examination of the dashboard reveals that there are the crucial factors adding to the likelihood of having diabetes. And these crucial factors are BMI, which is the body mass index, glucose levels, blood pressure levels, skin thickness, number of pregnancies, and age. These are all the factors that will depend if the patient gets diabetes or not. Navigating to the lung cancer dashboard, this reveals some other influential factors that can contribute to having lung cancer, such as age, gender, chest pain, smoking, and alcohol consumption. Moving on to CKD, also known as chronic kidney disease dashboard, there are other factors that contribute to this illness, such as blood sugar levels, blood pressure levels, age, blood urea, hemoglobin, and anemia. Assessing the successfulness of this approach. Determining the success of our approach involves key indicators such as increased awareness about chronic diseases based on lifestyle factors, adopting measures by individuals and communities that help guide you through the Power BI insights, and they may have a positive impact on patients, tracking changes in health outcomes, like a decrease in chronic diseases or improvements in early detection rates. Some limitations that could be looked at again in the future research. At this point, we do not have any information about genetics in our data, so we did not have the chance to figure out how genes play a role in contributing to chronic illnesses. In the future, we could improve this by adding more genetic data and we could get a complete picture if that affects a patient testing positive or negative for these diseases. We also want to make our data more relevant and accurate by including information from more diverse groups and population sizes, communities, and people. Therefore, working closely with healthcare groups would help us get real-time updates. These are some of the things that can be done better next time if this research is done again. Thank you for listening.